Hi, Carla.
Hi.
My name is Hayden. I'm a student physical therapist with UNLV, and I'll be taking you through your evaluation today. Does that sound good?
Sounds good.
So, first of all, can I get you to verify your date of birth, please?
April 10th, 1961.
Okay, thank you. And I understand you're coming in for some back pain, is that right?
Mm-hmm.
Okay. So what we're going to do together is just go through some questions. You can tell me about what's going on. And then after that, we'll just go through a battery of different tests and things so we can really figure out what structures in your back are giving you a problem. And then we'll come up with a solution for that we can help to treat in physical therapy. Does that sound good?
Sounds great.
Okay. So to do that, I'm going to need to just be touching like parts of your legs, hips, and in this region. Is that okay with you?
Yeah.
Okay, thank you. Now, to start off with, are there any pronouns that you prefer? No? Okay. And I saw that you did your intake paperwork, so thanks for doing that. So let's talk about the back problems you have. This has happened a couple times, is that right?
Yeah, it flares up on me every couple weeks to months. Sometimes I can get a couple months without it flaring up. But
Okay.
yeah, I've been dealing with it for a while, and by the time I get around to coming in, it's already kind of gone.
Oh, okay.
Yeah.
And is it usually when you bend forward to pick something up, like your dog?
Yeah, usually that's something that'll trigger it, or
Okay.
dishwashers or something like that.
Okay, so all kind of similar movements then?
Yeah, bending forward and then coming back out of it.
Okay, what kind of dog do you have?
Cocker Spaniel.
Oh, nice, dude. I had a couple of those when I was a kid. They're good dogs.
Nice.
What color?
Brown.
Brown? Okay, yeah. Nice. So, with your medical history, I understand you have a pacemaker.
Yes.
How long have you had that for?
A couple years now.
Okay.
Yeah.
And have you had any incidents that you've needed the pacemaker for?
No, doctor says everything's looking good.
Okay, and that's also what you take the medications for? That you
Yeah,
put down?
because I had a heart problem.
Okay, yeah. And then it also looks like that you've dealt with some anxiety or panic disorders in the past.
Yes.
Are you getting some treatment for that as well?
Mostly just meditate. Drink lots of water.
Okay, yeah, and that manages it okay for you?
Yeah, I can.
Okay. Now, I do have a question though about like the dizzy or fainting spells. Were those just with your heart condition, or are you still having them?
Oh yeah, no, I haven't had those since I started the medication.
Okay, very good. Yeah, nice. All right. So with your level of function, I understand that you're having problems with like household chores and stuff like that. Are you able to get dressed and things like that? Okay.
It's challenging, like putting on my socks and stuff like that.
Okay.
Kind of reaching down, you know,
Okay.
in that bending forward position.
Okay. Do you have to have anyone help you with that?
No, I can usually figure it out, but it does cause me some pain, especially when I'm having a flare up.
Okay. And what do you do for work?
I'm a school teacher.
Okay. Do you have, is your back pain holding you back from doing anything at work?
Not particularly, unless I've been sitting for a long time, but I
Yeah.
usually am standing up at the whiteboard teaching. You know, maybe if I'm having to lift some objects or something, but for the most part, just everyday teaching's okay.
Okay, so standing makes it a little bit better.
Standing, yeah, I'd prefer to stand.
Okay, yeah. Now I'm going to ask you a couple of questions just to make sure that there isn't anything more serious going on, okay? So have you experienced any night pain where it wakes you up and your back pain is really worse at night?
No night pain.
Okay. And any recent trauma, like a fall, car accident?
No, nothing like that.
Okay. Any sweating at night?
No,
Any constipation or bowel and bladder dysfunction?
no.
Okay, thank you. And I understand that your goals for therapy are to be able to pick up your Cocker Spaniel. And do you have any other goals that you want to work on while we're here?
Other than just getting stronger, so I don't feel so like unstable.
Okay, yeah, that's definitely something we can work on.
Okay.
Now, as far as like walking and climbing stairs, do you have any problems with those things as well?
No problems.
Okay. And for the pain, I understand it's best at 3 out of 10, worst 7 out of 10. Activity throughout the day makes it worse.
Yeah.
But just describing your pain, so it's in the back.
It's
Some-
just,
go
it's
ahead.
better in the morning, and then throughout the day it just gets worse.
Okay.
I kind of feel myself kind of slumping over a little bit.
Yeah.
and then, I feel tired.
Okay.
Yeah.
And then
I
it's
just want to lay down
oh, go ahead.
mostly. So.
Okay, yeah, just let it rest.
Yeah.
Okay. And it's worse, it's pretty stiff up here, is that
Yeah,
right?
I get like a weird tweaking feeling up there, but most of the pain is kind of down in here.
Okay. And also goes into the buttock region, is that right?
A little bit.
Okay. Do you ever have any pain going down your legs into your feet?
No leg pain.
Okay. All right, thanks for bearing with me through that. So now what we're going to do is we're going to go through just some of the movements you do throughout your day, just to see how you're moving, and then we'll get to some of those more specific tests, okay?
Okay.
So go ahead and stand up for me, please. All right, so the first thing I want you to do is just walk down there and just straight back to me if you don't mind. Okay, nice, that looks good, thank you. And then we're just gonna get you moving a little bit. So I'll be right here if you need me, but can you raise one foot up and stand on one leg? Okay, we'll say that's 30 seconds, good. Let's try the other one. Okay, 30 seconds, very good. Can you bring, actually let's go out to the side so you can turn towards me. Okay, good, no problems with that. Can you squat down like this? Can you back in with that?
A little bit, yeah.
Okay. Where did it start? Was that at the beginning or at the end?
More when I got towards the bottom.
The bottom of it? Okay, sounds good. And now we're just gonna move your spine a little bit. So put your hands on your hips for me. Go ahead and turn to your right. Look over that shoulder all the way, all the way, all the way. Any pain there?
No.
Okay, let's do the other side. All the way, any pain there?
No.
Okay, and let's go ahead and lean back.
Oh yeah, there's some pain there.
Some pain there, okay.
Yeah.
Go ahead and do that again for me. Tell me when the pain starts.
Right about there.
About there, okay. All right, and let's go ahead and put your hands to the side and just bend down to one side. Okay, any
That's
pain with that?
okay.
Okay, other side. Okay, on that side too?
Yeah.
All right, let's go ahead and try to touch your toes.
Oh, this is the worst.
All right, come back up. Okay, I want you to do it one more time and tell me when the pain starts, please.
Like right there.
Right there, okay, and where is the pain when that happens? You can come back up. Right in your back?
Oh yeah.
Okay. Thank you. You can go ahead and have a seat for just a second. Let me get organized here, okay? I'm gonna take a couple notes. All right, so while you're in this position, I want to test some of your hip strength. So let's go ahead and raise this leg up. I want you to hold it there. You can hold onto the table if you want. I'm gonna push down, don't let me push. Okay, good. This side, same thing. Okay, very good. And I'm gonna bring your foot into this position right here. So actually, first of all, we're gonna come here. Sorry if this hurts your back. I know it might just a little bit. Bring your foot up, your foot towards me here. Any pain with that?
No.
Okay, bend your head forward. Any pain with that?
No.
Okay, go ahead and sit up nice and tall for me. Thank you. All right, now you can go ahead and lay on your back. All right, I'm just gonna take a couple measurements. Okay, and we'd be doing everything on the unaffected side first, of course. Okay, let's go ahead and move this arm up just a little bit. All right, so I want you to go ahead and bring this leg all the way up towards, you can keep your knee straight first. Just go knee straight, all the way up towards you as far as you can go. Go, 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 go. Okay. Is that about it?
Yeah.
I'm gonna push a little bit more. Let me know if you get any pain. Okay, doing okay there?
Yeah.
Okay, go ahead and bring your leg down. Nice, thank you. All right, now, let's bend both knees up into this position here. We're gonna take both arms and just put them right down here. Okay, so I want you to try to curl up right here into a crunch. Okay, nice. Okay, very good. Just one's fine. Okay, let's bring your arms across your chest. I'll try to do that again, same thing.
Oh, it's much harder.
Okay, let's try it one more time. Try to get your shoulder blades off the table. Okay, go ahead and come back down. You're fine there. Now I'm going to take your legs into this position here. come up like this. Can you raise your right leg off my hand? Okay, let's go other leg. Okay, you're good there. Now we're gonna go like this. I want you to bring this leg down, tap the table, and bring it back up. Okay, slide your heel like this. There we go. Let's try that again. So we're gonna come from this position. We're gonna slide it, bring it back, up to this position. Okay, ready, go. Okay, very nice. Now, I want you to bring this leg like this, hover it above the table, and then back up to this position. Can you do that? Yeah, hover.
I don't think I can do that.
Okay, not quite. That's okay. Nice, good job. All right, next, you're gonna have to trust me a little bit, okay?
All right.
So, go ahead and turn on your back for me, please.
Turn onto my back.
Onto your back, please.
I'm on my back.
Oh, excuse me, on your stomach. Okay, I'm gonna hold your legs for this one. And what we're gonna do is we're gonna scoot you up towards this right here. So you're gonna put your arms on that. I'm gonna help you come forward. We're gonna just scoot forward a little bit more at a time. It's gonna feel like you're gonna fall off. You're not. Use your arms to support you. Okay, I want you to lift up off the table just using your back muscles. So let go of the chair when you can, and we're gonna hold that for as long as you can. Okay, we're gonna say that's about 30 seconds. Okay, very good. I'll come here. I'm gonna help you back up. Ready? Let's work our way back up here. Okay, there you go. Okay, while we're here, we'll take one more measurement. All right, so I want you to bring, when I say go, the hip up towards the ceiling as far as you can. Ready, go. Okay, nice, I'm gonna push you a little bit more. Any pain there?
No.
And you're gonna pull your shirt up just a little bit. And just feel around on your back, okay? You got some muscle tightness over here. Is this usually where you feel that, the tight muscles, the spasms?
Yeah.
Okay. Do you have any pain through here?
No.
Okay. I'm going to see how your back is moving, just at the joint level. Let me know if there's any pain. Any pain with that?
No pain.
We're going to come up a little bit higher to where you're feeling the stiffness and see how these segments are moving, okay? Any pain with those?
No.
Okay, just a couple more here, okay? Go ahead and relax. All right. Okay, so with this leg again, go ahead and reach that up towards the ceiling. We're just going to hold it in that position, okay? Can you hold that there? I'm going to push down, don't let me move you. Okay, good. All right, and go ahead and roll onto your side for me, please. Come right up behind you. All right, now let's raise that hip up into this position. Hold that there. Don't let me push down. Okay, very good, nice and strong. All right, and then you can go ahead and roll onto your stomach or onto your back. All right, we're gonna test your hip just a little bit. Okay, so I'm gonna have you just lean up like this. I'm gonna put my hand underneath, okay? Okay, come back. I'm gonna bend your knee up into this this position here and put some force downward. Any pain with that? Okay. Now I'm going to move your hip around just a little bit. Any pain there? Okay, good. All right, last one here. We're going to take this leg. We're going to go up towards the ceiling with it. Just get your knee all the way straight. Good. And that towards you. Do you get any pain with that? No. Okay, all the way back down. All right, you can sit up whenever you're ready. All right, Carla, so what I think is going on with your back is that you have a lot of movement. A lot of movement in your lower back, and then also some stiffness in your upper back. So what that means is when you're bending forward, your muscles are trying to really compensate and protect that, but also the movement is just causing some irritation of the tissue surrounding that. What that means is that in physical therapy, the main goal is going to be to strengthen the muscles around those joints in your low back to just give some added stability. And so we'll start to work on that today. But also what we're going to do is just get some motion to your upper back segments so you can move those a little bit better. You won't have to compensate with the low back as much. Does that make sense to you?
Yeah.
Okay. So to do that, we're going to start with today. I'm going to mobilize your upper back, get some more motion there. I'm going to teach you some exercise to start strengthening your core muscles, not only so they'll just be strong, but they'll also stabilize your back. And then we'll work on some things that you can start doing at home. What PT will look like is about 6 weeks of treatment. I'd like to see you twice a week. After 3 weeks, we'll reassess just to see where you're at and make any adjustments as needed. But we'll primarily be focused on strengthening, okay? What questions do you have for me?
No questions at this point.
Okay, it's nice to meet you. Thank you.
Nice to meet you. Thank you.
Yeah.